All right, let's talk about a medical emergency that is an absolute master of disguise, one where just a matter of hours can change literally everything. This is our explainer on acute scrotal pain, and the first thing you really need to know is the clock is already ticking.
Okay, if you walk away with just one piece of information today, I want it to be this number, 6. That's how many hours you have. It's the number that can mean the difference between a full recovery and a permanent, life-altering loss. It's the critical window where every single minute counts.
You know, in the world of emergency medicine, they have these sayings that get right to the point. And this one is about as blunt as it gets. Time is testicle. It's a stark, unforgettable reminder that with every minute that ticks by, the stakes just get higher and higher. There's absolutely no room for wait and see.
So what makes this 6-hour window so incredibly dangerous? Well, it's because this emergency is a trickster. It's a master of disguise. The body can send out these really confusing signals, clues that point you in a completely different direction, all while that critical clock just keeps ticking away.
And look, that 6-hour countdown, it's not some loose guideline. Think of it as a hard, biological deadline. The data is crystal clear. There's a dramatic shift in outcomes once you cross that threshold, and it's absolutely crucial to understand why.
Okay, so take a look at this. The numbers really tell the story here, and it is a stark one. If surgery happens within those first 6 hours, the chance of saving the testicle is fantastic. We're talking 90 to 100%, basically a slam dunk. But just look at what happens after that. The drop-off is like a cliff. Between 6 and 12 hours, your odds plummet to a coin toss, about 50%. And if you wait a full day, the chances become just tragically low, less than 10%.
But, and this is so important to understand, that 6-hour mark is not a point of no return. It is never ever too late to get help. Even after 6 hours, this is an absolute lights and sirens emergency that needs immediate surgical evaluation. Every case is different, and there is always a chance to intervene, so you never ever just give up.
So this all brings us back to the central problem here, the real villain of the story, mistaken identity. The number one reason why that precious time gets lost is because the symptoms of testicular torsion are just so misleading. They can point towards a totally different, and frankly, a much less urgent problem.
Right? So how on earth does this happen? It just seems so counterintuitive. The problem is clearly in the scrotum, so why in the world would the symptoms make you think you have something like a urinary tract infection? Let's break down the biology behind this dangerous mix-up.
Okay, so it really just comes down to the body's wiring, almost like faulty electrical work in a house. The nerves that serve the testicles, well, they share pathways with the nerves from your urinary tract. So when the pain from torsion gets really intense, the brain just gets overwhelmed. It gets its signals crossed and misinterprets where the pain is coming from. That's what doctors call referred pain. And when you add in some reflex bladder irritation and inflammation that starts to spread, bam, you've got a perfect storm of confusing symptoms. Okay, so with all of this potential for confusion, how do doctors on the front line figure it out? How do they tell the difference between testicular torsion, a get-to-the-operating-room-now emergency, and something like epididymitis, which is a simple infection you treat with antibiotics? This is where the real clinical detective work begins.
All right, clue number 1, and honestly, this is the big one. It all comes down to the origin story of the pain. How did it start? Torsion hits you like a lightning bolt. It's sudden, it's severe, and it often wakes people right out of a dead sleep. An infection, on the other hand, is more of a slow burn. It tends to build up gradually over hours or even days. This one detail is often the clearest dividing line between the two.
Now, beyond just how the pain started, there are other key differences. With torsion, feeling nauseous is really common, and the testicle itself is often pulled up high, maybe even sitting horizontally. But maybe the most telling physical sign is the absence of what's called the cremasteric reflex. In a typical infection, that reflex is there, the position looks normal, and a urine test might actually show signs of bacteria.
But out of all those clues we just talked about, there is one physical sign that really stands head and shoulders above the rest. It's the closest thing we have to a smoking gun in the clinical diagnosis of torsion. So first, what even is this thing? The cremasteric reflex is basically a built-in protective mechanism. When you gently stroke the inner thigh, a little muscle called the cremasteric muscle contracts, and it pulls the testicle on that side upwards. It's a super simple, totally involuntary reflex.
Okay, here's the kicker. In cases of testicular torsion, this reflex is almost always gone. It's absent because the spermatic cord is all twisted up, like a knot in a wire. The nerve signal's interrupted and just can't get through. This makes its absence the single most reliable physical sign that points straight to torsion.
So let's put it all together. When you see this whole cluster of red flags at once, that sudden severe pain, the nausea, a testicle that's riding high and sitting sideways, and especially an absent cremasteric reflex, well, the diagnosis of torsion becomes overwhelmingly likely. These are the signs that should be screaming emergency.
So what's the verdict? When the signs point to torsion, there's only one course of action, and it has to be taken without a single moment of hesitation. It's all about speed.
And this is a really critical rule for any healthcare provider listening. An ultrasound should never, ever delay surgery. Look, can a scan confirm the diagnosis? Sure, but if the clinical signs are strong, that patient needs to go directly to the operating room. Every minute spent waiting for a scan is a minute lost from that critical 6-hour window.
You know, this all boils down to one fundamental guiding principle for treating acute scrotal pain. You have to assume it's torsion until you can prove it's not. The risk of getting it wrong, of missing a torsion, is so catastrophic that it's infinitely safer to perform an exploratory surgery on a false alarm than to wait and be tragically wrong.
So, to wrap all this up and give you something easy to remember, just think of this simple mnemonic. 6 equals save. S is for the sudden pain. I is for ischemia. That's the immediate lack of blood flow. And X, well, X marks the spot on that critical 6-hour window. You act fast within that window, and you save the testicle. Simple as that.
So, after all that, what's the one crucial point you absolutely have to take away from this? It's incredibly simple. When in doubt, do not wait. For any sudden severe scrotal pain, the only safe, smart choice is to get immediate medical help. Because as we've seen, that clock, it is always ticking.